if we stick to transplant-eligible patients, I had a particular interest to Forte study, the EMN Italian GMEMA study presented by Francesca Guy, not because of the Forte per se study. Just to remind everyone, it's a VCD transplant, it's a KCD transplant, sorry, versus K-Revdex, carfilzomib Revdex, no transplant, 12 months, 12 cycles, versus K-Revdex transplant, comparison, 3 arms. And what Francesca Guy has showed at ASCO that to me was of amazing importance and interest was that the median, the percentage of MRD negative patients at the end of the treatment is almost similar across the two K-Revdex arms. Okay. One being transplant, one being non-transplant. So logically, you would ask yourself, why then no need to transplant anymore? Mm-hmm. Well, and so at ASCO, she has updated this data. And it's like, and she actually came up with something extremely important to remember, which is that she has looked at MRD at 10 to minus 5. And now, when she looked at the patient who reached MRD negativity, and now sort of look at the same patients a year later, approximately 70% of the patients, so a year later, remain in MRD negative, so about 20-25% of the patient lost their MRD negative status to MRD positive status in the non-transplant arm. So that's very interesting because it kind of tells you that you could give an amazing regimen up front, and carfilzomib, Revlimid, dexamethasone is an amazing induction and consolidation. But if you don't transplant, you will get some MRD negative data, but you may lose upon time this amazing negative status if you are not transplanted. So there are various reasons to that. One of them is probably that the transplant adds some more depth to the MRD. Since they looked at MRD 10 to minus 5, maybe with transplant, you have more patients that are minus 5 negative, but in fact minus 6 negative, while without transplant, you may have more patients minus 5 negative, but minus 6 positive. So this is very early on, this is very primary, but this notion that MRD is only valuable if it's sustained. Here you have an idea about how much you could lose this kind of sustainable MRD. So this is very important to us because it proves the point that reaching MRD cannot be the ultimate endpoint. Maintaining MRD is more important. So that's very interesting.